Okay, this is the patient. This is the bed we'll be using here. The tools we'll be using. The recorder, Kendria. Okay. This is the door, the floor. This is the ceiling. The dresser. Put this on there. Okay, Kendria. Knock, knock. Hello, how are you? Good. My name is Erica, and I'm a nursing student at the University of South Alabama. Today, what I'll be doing is I'll be doing your abdomen assessment. I want to first ask you, is it okay if I record you and send this video to my instructor for grading? Okay, because I'm taking the course NU 325, which is a health assessment, okay? So, what I want for you to do is, do you first have to empty your bladder? No? Okay. So, I want you to lay right here on this pillow for me. Okay, can you put your legs straight for me? Can you bend your knees? Okay, can you put your hands by your side? Good. So now what I'm going to do is I'm going to inspect your abdomen, okay? So as I look at your abdomen, what I'm looking for is I want to make sure everything is contoured. I'm looking at your skin color. So your abdomen is flat. Your skin tone is a normal skin tone. It's brown, and it is it's normal. I see no abnormalities in your skin complexion. I do see a mole there. Your umbilicus, it is inverted and it's midline. I don't see any kind of pulsations, no peristalsis. I don't see any kind of scars or lesions. I see no masses, nor do I see any lesions or hernias. Okay? So next what I'm going to do is I'm going to auscultate, meaning I'm going to listen to your bowel sounds, okay? So I have my stethoscope here, and I'm going to listen to your bowel sounds with the diaphragm of my stethoscope. And I'm first going to start in your lower right quadrant, okay? And I'm going to work my way around. Okay, good. So with your bowel sounds are normal. There are 4 types of bowel sounds I'm going to explain to you. So yours are normal. They're loud, high-pitched. They're gurgling sounds. Usually with your gurgling, your bowel sounds will be cascading 5 to 30 times per minute, okay? Hyperactive bowel sounds, meaning that they're also high-pitched, but they're kind of like tingling, rushing sounds. They're going to cascade more than 30 times per minute, okay? Your hypo bowel sounds, they are more on the low pitch side, can't hear them very much, and they're going to cascade less than 5 times per minute, okay? Now with your absent bowel sounds, meaning I didn't hear any bowel sounds at all, what would happen is I would have to go back and listen to your lower right quadrant for 5 minutes, okay? So next what I'm going to do is I'm going to listen to your arteries. So you have 3 arteries. You have an aortic artery, you have a left and a right renal artery, a left and a right iliac artery, okay? So I'm going to listen to those with the bell of my stethoscope, okay? And what I'm listening for buids. So I'm going to first start with the aortic, okay? Now I'm going to go to your right renal artery. Now I'm going to go to your iliac artery. Now I'm going to go to your left renal artery. And now your left iliac artery. Okay, good. I heard no sounds of a buid noted, okay? So next what I'm going to do is I'm going to percuss, okay? So I'm going to listen for any timpani and any kind of dull sounds, okay? So I'm going to get my hammer here. I'm going to place my hands here. Press down a little bit, okay? Okay, good. So I heard a little bit more tympani more on your left side than I did your right side. That is normal. It was a little dull on the right side, but that's okay. 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 So next, what I'm going to do is I'm going to palpate. I'm going to lightly palpate your abdomen. Okay. So when I'm lightly palpating your abdomen, I'm looking for any kind of looking for your muscle tone and your contour of your abdomen. Okay. So I'm going to lightly palpate. Did you feel any kind of pain or tenderness there? Any tenderness? Okay. So now I'm going to do a deeper palpation, and with the deeper palpation, I'm listening, not listening, but I'm searching for any kind of masses to make sure I don't feel anything, any kind of little knots. Okay. I'm going to get my 4 fingers. I'm going to go a little deeper. Any kind of pain or tenderness there? No pain? Okay, good. No pain or tenderness noted. So next, what I'm going to do is I'm going to assess your liver. Okay? So I'm going to put my hand right here. And what I want you to do is take a deep breath and hold it, okay? Exhale. Do it again. Exhale. Do it again. Exhale. Okay, good. So the only thing that I felt was the edge of your liver. And another thing, another way we can assess your liver, if you hold your hand up for me, it's a hook here, right here. There's a hook, okay? So you would take a deep breath in and go out. Good, okay? So next I'm going to assess your spleen, okay? So I'm going to put my hand over here. Turn over just a little bit. Now I want you to take a deep breath in. Breathe out. Do it again. Breathe out. Okay, I did not feel your spleen, so that's a good sign, okay? Okay, so next what I want you to do is I want you to sit up. Okay, I want you to turn this way. You can walk around. Okay, so now what I'm going to do is I'm going to be assessing for your cerebral vertebral angle. So I'm going to put my hand right here. It's usually within that 11 or 12 vertebrae here. So I'm going to put my hand here and I'm going to strike it back, okay? And I'm assessing for tenderness, okay? Any pain or tenderness there? Any pain or tenderness there? Okay, so no pain or tenderness noted. This is the end of my assessment, and we're going to scan the room one last time. Patient, 4, ceiling.